Hello and welcome, ladies and gentlemen, to a new edition of the Daily Debate. In tonight's show, we're going to be focusing on two topics. The first of which, Egypt today has concluded, actually about 10 minutes ago, the runoff of the first phase of the parliamentary elections. This was held in 13 governorates across Egypt. We're going to be talking about the voting process, the elections in general, and we're going to be focusing on what we should be expecting for the final results as well. That'll be the first topic. The second topic for tonight's show will be the second wave of the coronavirus that has taken over the whole world. We're going to be talking about the Egyptian preparations to combat the resurgence, the second wave of COVID-19. That'll be later on. But first off, before we start focusing on our topics for tonight, let's check out some of the stories making the news today. And we'll start off with President Abdel Fattah al-Sisi instructing today to immediately establish plasma derivative centers in Egypt. The president also gave his directives to initiate a vital and precise mechanism which guarantees the best performance with the Spanish company for gathering and manufacturing plasma derivatives, Grifols, stressing that the project has a priority at states level. This came during the president's meeting with the head of the Spanish company in the attendance of Prime Minister Mustafa Madbouli, Health and Population Minister Dr. Hala Zayed, and Presidential Advisor for Health Affairs Dr. Mohammed Awad Tageddin. Presidential Advisor Ambassador Bassam Radi said the meeting reviewed the general implementation plan of the national project for collecting and manufacturing of plasma derivatives in Egypt in partnership with the Spanish company Grifols. For their part, Grifols officials expressed their honor for meeting President al-Sisi and their happiness for cooperation with Egypt in the field of technology. Also, the second and the final day of voting in the runoff of the first phase of the parliamentary elections concluded today about 10 minutes ago, with 220 candidates competing for 110 seats in the individual system. Voters cast their ballots in the governorates of Giza, the New Valley, Fayoum, Beni Suef, Minya, Asyut, El Bahira, Sohag, Inna, Luxor, Aswan, Alexandria and Matruh over 2 days. 32 candidates won in the first round of the first phase of the elections, which are being carried under a full judiciary supervision and amid precautionary measures to prevent the spread of the coronavirus. The final results of the parliamentary elections are to be formally announced by the National Elections Authority on December 14th. These were a couple of the main stories making the news today, but now let's go check out this report regarding the runoff vote for the first phase of the parliamentary elections that took place in 13 governorates, and we'll be right back.
The runoff voting in the first phase of the House of Representatives polls wrapped up in 13 governorates on Tuesday. Voters cast their ballots for 2 following days in the governorates of Giza, the New Valley, Fayoum, Beni Suef, Minya, Asyut, Bahira, Sohag, Qina, Luxor, Aswan, Alexandria and Matruh. 220 candidates are competing over 110 seats at the lower house of parliament. The turnout for the first round of the polls was 28.6%. Women lined up at the stations and were seen participating heavily in the election process, especially in Qina governorate, located in Upper Egypt and Bahira. Anti-COVID-19 precautions, which was strictly followed amid the elections, including social distancing, wearing masks and using alcohol. Intensive security measures were also seen around polling stations to protect the runoff election, as a comprehensive security plan was announced to be adopted to secure citizens while casting their ballots during the electoral process. The first phase of the election was held for Egyptian expatriates abroad from the 21st to the 23rd of October, and locally from the 24th to the 25th of October. The Ministry of Interior adopted a comprehensive security plan to secure citizens while casting their ballots during the electoral process, according to official statements. The measures included traffic services to facilitate the voters' access to the electoral commissioners, along with surrounding the polling stations with security troops. National Elections Authority held a press conference to announce the results of the first round of the first phase of the voting in 2020 House of Representative elections. Head of the National Election Authority, Councillor Lashin Ibrahim, stated that the turnout is 14 governorates. Included in the first phase was 28.06%, and that's almost 9 million out of the 31 million eligible citizens voted. Regarding the list, the national list for Egypt won the electoral district of Upper Egypt, composed of 11 governorates, and Western Delta, composed of 3 governorates, securing 100 seats in the former and 42 in the latter. It was competing against the Egypt's core list, according to the updated voters database by the National Elections Authority.
Welcome back, ladies and gentlemen, and now we're joined over the phone by Dr. Hassan Wagih, the Professor of Political Science and Linguistic Negotiations. Dr. Wagih, can you hear us, sir?
Yes, how are you, Hani?
I'm very well, sir. Dr. Wagih, first off, today is the second and final day of the runoff vote for the first phase of the parliamentary elections, held over 13 governorates. So far, how smoothly was the electoral process? How was the polling stations? Were they safe, secure? We didn't really hear any reports of any violations or irregularities or violence. How would you assess this election process?
Actually, the election process went so smoothly. Everything was well prepared. There were precautions against coronavirus, one of the most important elements. And also, it went well in the final round.
What about the expats abroad? The expats were to cast their ballots through mail to avoid any sort of personal contact, to avoid any resurgence or infections for the coronavirus. How would you compare these elections to previous parliamentary elections?
Actually, we have special context, which is coronavirus. And all over the world, this is very legitimate and very well done by many people that are going to elections. Actually, people can get things through the digital world and through emails, through the mail in general. This is very well recognized in the United States and other places in the world.
Well, the turnout for the first round of the polls was about 28.6%. Do you feel that the coronavirus really did affect the turnout for the elections?
Of course, this is 100% is the case. People from all ages would seek refuge from the crowds and from be precautionary about the coronavirus. And this is a story everywhere in the world these days, that the coronavirus has impacted every aspect of life. Yes. And even when we hear that someone is having corona, this would make them abstain from taking the risk. This is the natural. And this is the impact all over the world.
Dr. Wagih, now there are 220 candidates that are competing for 110 seats. Only 32 candidates won in the first phase, the first runoff for the first phase so far. How competitive do you feel the election is, the competition between the individual seats, between the candidates? How would you rate it?
Actually, the competition is there among the proponents and the supporters of each candidate. But let me be frank and open that many people did not have that chance to know who are the people, what are their profiles. Let me connect your question with the previous one. We have even the people in the digital world, especially the youth. And I think that we have to know that this is a challenge to get people from virtual world to the real world and to get them involved in such a process, because we need to exert a great deal of effort to democratize. And this part of the democratization is to people to habituate people to go to vote and to know and to seek the vote, who is being voted for, and know everything about that candidate and why they prefer one candidate over the other. This is a culture that we need to cultivate, and we are starting out in a good way. Hopefully, we will get better in the next round and next elections, inshallah.
Yes. Dr. Ogi, now, the national list, which won the first stage, consisting of 12 parties, it's led by the nation's future, or Mustaqbal Watan. Can you tell us more about it, its agenda? What plans do they have for the Egyptian society?
Actually, let me be very open about it. It is a very good question on your part. But in elections, that party or other one, we all the time listen to very well stated statements and very well glittering agenda, and we like that, and we like that to be achieved. So the agendas are glittering enough, are good enough, but what is meant to be seen is the performance of implementing these agendas for the sake of progress in our beloved country.
Well, how would you rate, before the new parliament is convened after the end of the electoral process, how would you rate the performance of the previous, or the current, actually, the sitting parliament? Do you feel that they have delivered all the promises that they made during their electoral process?
Yes, actually it is still premature to judge the performance. But let us say that they are warming up in a good way. Hopefully to see the performance is getting better and better with the processes of the coming days, coming months, to seek and to gauge their involvement and their interaction in the real challenges. And there are a lot of challenges that surround us. So I wish them all good luck to have excellent performance that would serve the agenda of upgrading the level of the entire performance of the state.
Dr. Ogi, you've mentioned the youth. Do you think that in this time around for the new parliament, do you think there will be a proper representation for the youth and women?
Yes, I believe that the factor that the political leadership has the right to inject the parliament with some people. I think they assigned a very good portion for women and for the youth. And actually, there are so many of the young people who have good aspirations for their country, and they ran for these elections. And this is promising, inshallah.
Well, you've mentioned the leadership. The president will actually appoint 28 seats, which is about 5% of the parliament. What would you say would be unique about this parliament as opposed to the previous parliaments?
Actually, this would go to the, let me have a reading like that. This would enable us to have much more balanced representation so far possible to be achieved when we have this kind of assignment versus voting.
Dr. Ogi, now, quite recently, there were the elections for the Senate Council. Now, how would you describe the relationship that will be between the upper house of parliament and the lower house of parliament? What are the dynamics of the relationship between both?
Actually, the dynamic should be dynamic. Yes, there should be some kind of good cooperation, good orchestration of the tasks. I think that the discussion with the manifestation of orientation of from people in the parliament would be okay and would be good and would be good for a decision-making process that would represent all the people who were voted and represent the parliament. But the Senate, let us say, they are the people of wisdom, much more, supposedly much more strategic, much more informed, and they have the time and the orientation, and their character is supposed to be that kind of playing the super game, which could inject the parliament with views regarding especially critical issues that need well-established experts and experience. So I think they would complement each other for the sake of reaching a far more effective decision-making process regarding the challenges that we face.
Dr. Goy't, it is a bit premature before the conveying of the new parliament, but as a political analyst and a political science professor, what would you want to see a new parliament actually tackling for the next year and the next couple of years? What sort of issues? We've seen work being done in the health sector, education, obviously the coronavirus. What sort of files would you like the new parliament to tackle?
Okay, the immediate one all over the world, the immediate task all over the world is the coronavirus. Of course, people are preoccupied till we get rid of this epidemic. Inshallah, would work out. And this is agenda number one.
Yes.
It's a challenge of the digital world and the electronic negotiation, if you want to say. How could we bring these young people from virtual reality into reality? Egypt is very rich with the young people. Almost 55 or 60% are the young people who really are the future of Egypt.
Yes. Ladies and gentlemen, that was Dr. Hassan Goy't, the Professor of Political Science and Linguistic Negotiations. Dr. Goy't, thank you very much for joining us. Ladies and gentlemen, now moving on to our second topic of discussion, a topic that has been under the spotlight for almost a year now. The coronavirus, now the whole world is suffering from a second wave, and Egypt is no different to that. Let's check out this report regarding the preparations taken by the Egyptian government to combat and try and deal with a second wave of COVID-19, and we'll be right back.
Minister of Health and Population Dr. Hala Zayed ordered health directorates across the country to increase the capacity of isolation hospitals as she announced the beginning of the second wave of the coronavirus in Egypt. The minister confirmed that there is a sufficient strategic stock of medical supplies in governorate hospitals to face any increase in coronavirus infections. She said an increased coronavirus infection rate is very much related to the beginning of winter in Egypt, attributing the rise to people not abiding by precautionary measures and stressing that schools are not in the cases or the reasons behind the increase of the COVID-19. She noted that protection against this pandemic is primarily a matter of precaution and physical distancing, underlining the need to put on masks all the time and always sanitize surfaces. But Zayed still believes that the level of infection remains mild despite the rise of the number of cases. According to the minister, the second wave will not be more dangerous than the first and that the recovery levels have reached 92%. Zaid said the residents of Alexandria and Cairo are the most infected by the virus in Egypt and are followed by Giza, adding that infection rates are lower in upper Egyptian cities. She expected a rise in the number of infections and deaths during the month of December and January, reiterating that precautionary measures must be heeded, especially in the closed places. She also said that President Abdel Fattah el-Sisi and the Prime Minister Mustafa Madbouli are closely following up on the evolution of the coronavirus worldwide. She made it clear that 60% of the chest diseases and fever hospitals have been equipped with ventilators and medications to help them cope with the pandemic, adding that a coronavirus treatment protocol has been updated. Zaid advised citizens to minimize their time they spend inside restaurants and closed places and to keep the masks on. She warned that the chances of getting the virus are 3 times higher without the mask. The minister said that the e-payment should be activated, urging people not to touch bills or coins and to always wash their hands. She stressed that the elderly and people suffering from chronic diseases should regularly take their prescribed medication and that a quick treatment always translates into a better results where coronavirus patients are concerned.
Welcome back, ladies and gentlemen, and now we're joined here in the studio by Dr. Ghada, Nasr, the Professor of Public Health at the Faculty of Medicine, Cairo University, and WHO consultant. Dr. Nasr, thank you very much for joining us.
Thanks, Mr. Hani, and thanks for having me here.
It's a pleasure.
Very important.
Dr. Nasr, now everyone has been talking for almost a year now about the coronavirus. People were pretty scared, and they are still scared with the resurgence of a second wave. Now, how would you evaluate this second wave? Because there are a lot of people talking about, well, it's going to be much worse than the first one. Some people are saying, no, the virus starts getting weaker, so it's not going to be as harsh and fatal as in the first wave. What is true and what is not? Can you please clarify it?
Thanks for having for asking this question. This is very important, and I think it's the role of the media to clarify to the people what is the true science and what are the true facts and what are the myths. And as you said, Corona is a fatal, the world has been plagued by this pandemic, and almost every country in the world has been affected by the virus. And as the people know that millions of cases have been infected with the coronavirus, and over 1 million deaths have occurred. So it's not an ordinary disease. It's a disease that is new to the whole population, to the whole world, that is experiencing a new virus that was not known before. And we still don't know a lot of information about this virus.
Yes.
Still, we don't know if the people who are infected are susceptible again to reinfection or not. We don't know how long the immunity lasts. If the person gets infected and get immune, usually the body develops antibodies for the viruses and bacteria that the body experiences. How long the immunity lasts? Does it last for months, for years, for weeks? We don't know. And the quality of the immunity as well. All these factors, and along with the lack of cure, 100% cure for this virus, and we still don't have a vaccine or a chemoprophylaxis or a drug that prevents the occurrence of infection. With all these gaps, we still cannot predict what will happen. What we need to understand that we still need to have our mitigation measures as a country, and as individuals we should continue our precautionary measures in order to avoid or to prevent the upsurge in the number of cases and increased transmissibility. You know that we are approaching winter.
Yes.
And people are usually confined in very crowded places and places with ill ventilation. And this is a very favorable environment for the transmission of the virus. It likes this environment. People are very close. The proximity between people, the lack of enough ventilation favors the spread.
Yes.
So that's why we are saying that we are on, there might be another wave of the coronavirus. Usually the epidemic takes a bell curve in its spread. Usually it starts with a few number of cases, and the number of cases grows gradually to reach a peak, and then it slows down, and there is a decline in the number of cases. And this is what happened actually in countries all over the world. And in Egypt as well, the number of cases declined. It doesn't reach zero because, as I mentioned, not all the people get infected. There are still so many people are susceptible, and we don't even have data how much people are infected in Egypt because we don't have a lot of tests or screening tests done to the whole population to know how many people get infected. So the curve is declined, but it doesn't reach to zero. The number of cases at the beginning of this month was around 170. At the end of this month, it's today, I think the Ministry of Health, or yesterday, announced that we have like 359 cases. So it shows that the number of cases has doubled, which is an alarming signal. We are approaching winter. The number of cases is doubling. Rings a bell that we need to be more cautious and take more preventive measures.
Yes. Well, Dr. Nasr, as you mentioned now, we are practically in the winter season, so we have the end of this month and December and January, and this is usually a seasonal time where everyone gets a cold or a flu or an illness. So when should someone differentiate, or how can someone differentiate between being infected by the coronavirus or just a seasonal regular flu? When should people start freaking out, and when should they be reasonable? Because some people are saying, no, unless you have like extreme diarrhea or like a fever or like lack of smell and taste. So are these necessary only for COVID-19, or can we not have any of these symptoms and still be infected?
Again, thank you for this very important question, because we need, again, to inform the people about the truth about this myth. We don't need actually for the public to know whether they have flu or they have COVID. This is not for the public to worry about. Because both affecting the respiratory tract, they both cause symptoms that are very close to each other. And for the ordinary people, they need only to know that if they experience symptoms of flu, they should stay at home. They should do all precautionary measures. They should have their symptomatic treatment. If they have mild fever, they should take antibiotic. If they have aches, they should take the analgesic and so forth. It doesn't matter if this is flu or COVID-19, it doesn't matter. Because even in COVID-19, the majority of cases resembles flu, and they recover with the ordinary care. What the people need to know is the alarming signals. Because when they experience such symptoms, they need to seek medical care. They need to seek their physician or the hospital, whatever, if they have one of these alarming signals. If they have fever, very high fever that does not resolve, if they have sore throat and dry cough and it's painful, if they have body aches and headache that also does not resolve with the routine or the ordinary analgesics, if they have dyspnea or difficulty in breathing, if they have also severe diarrhea that does not resolve after 1 or 2 days, if they have such alarming signals, at this point, they should seek medical care. Otherwise, they should keep themselves at home. They limit their contact with other family members. They should stop going to the work or the schools or universities or whatever. As I mentioned, they should take their symptomatic treatment, the prophylactic treatment. They should have a good nutrition, a lot of fluids, and in order to dissolve the sputum and relieve any respiratory symptoms. And if they have one of the alarming signals, at this stage it's important to seek medical care, and at the medical facility they will do the necessary test to know whether this is COVID-19 or the ordinary flu.
Yes. Well, Doctor, now we've heard from the Minister of Health Dr. Hala Zaid and the Prime Minister Mustafa Madbouli, they spoke about having enough supply and sufficient supply of the medications at pharmacies according to the protocol to be followed if you're infected with COVID-19. Also talking about the availability of hospitals and isolation hospitals and everything. How would you rate the performance of the Egyptian government in trying to deal with the coronavirus during the first phase and the second phase so far?
Actually, I am publishing a paper about how Egypt and the government of Egypt were prepared and proactive in responding to COVID-19. And I feel that Egypt took a proactive steps in this respect. Since the inception of the epidemic, His Excellency the President of Egypt were following up what's happening, and the announcement and press releases were always up to date and following up what's happening. The quarantine of the first case since the 14th of February, the first case was announced. And then the curfews and isolation measures that was put in place for cases and for people coming from Wuhan, from China, in Matruh. And all the steps all through the process were very evidence-based, were very scientific and based on best practices worldwide. And even in the reopening process, when Egypt starts reopening businesses and schools and universities, were also evidence-based. In the meaning that it was based on what we call the epidemic characteristics, because we cannot reopen businesses and schools if we have a high growth rate of the epidemic, if the number of cases are growing very rapidly. There should be some stability and at a lower rate in the growth of cases in order for the country to reopen its businesses and schools and universities and all the activities. And we still have restrictions. The public education campaign was very necessary from the beginning. It educates people on how to use the masks and the importance of using masks, the hand hygiene and hand washing, the cough etiquette, and the social distancing and physical distancing. This was an important pillar in the prevention of the spread of the epidemic. And one important thing that you pointed out is the preparedness of the health system. And we call it the health system resilience. How the health system can respond to crisis and adapt to these critical situations. It's very important. We know that 5% of the cases require to be hospitalized in intensive care, and they require assisted ventilation. So the hospital should be equipped with these equipments and like also the diagnostic facilities like the CT and X-rays. And that was key in all the activities of the Ministry of Health, how they prepare hospitals and also engaging the private sector, university hospitals, so that they prepare additional beds to accommodate the potential increase in the number of cases. So this was one of the important pillars, and the availability of supplies, medical supplies, which is the personal protective clothes for the physicians. You know that the infection rate is very high among the healthcare workers, physicians, nurses, and other staff in the hospitals. So it was very crucial and mandatory to provide such protective measures for such staff. Ensuring that they can protect themselves, because they also not only protecting themselves, because they communicate with other family members, and they can spread the infection from the hospital to their homes if they don't take the strict precautionary and preventive measures. The medications, Egypt is very up to date, and I'm also a member in the Supreme Committee for Respiratory Diseases for the High University Council, and we get protocols for treatment from countries all over the world. We appraise them, we review them, and We see which guidelines can suit our patients and the medications that are available. So all these efforts together actually put Egypt in among the countries that currently with the lowest prevalence of cases. We are not among the countries that have a very high burden of COVID-19 cases. And I think this kind of preparedness of the health system, together with the education and awareness campaign, provision of supplies and personal protective measures for healthcare workers and even for the public,
yes,
at lower prices, all these factors together reduces the burden of COVID-19 in Egypt.
Yes. Dr. Nasr, now talking about the evaluation of medicine from different countries around the world, also there's been a lot of talk and reports about vaccines. 2 vaccines, maybe in the US, also a vaccine in Russia. They're talking about maybe this is about 90% effective or 95%, and it varies from one vaccine to another. Now, first of all, how reliable are these vaccines? Does the WHO review them? Could they guarantee the safety of using them? Do they have any side effects on different people? And so is it reliable? And these vaccines, are they responsible to actually just keep you immune from contracting the virus, or does it help you get better and get well if you're infected?
This is very important question. Thank you for raising it. The vaccines, the vaccine development actually passes into phases. We do what we call clinical trials for the vaccine. We have phase 1, phase 2, and phase 3. Most of the vaccines, which are hundreds of vaccines, are in different phases from 1, 2, and 3. Very few vaccines reaches phase 3. In phase 3, we try the vaccines on large number of people. They don't have the disease, and we follow them over time to see how many of them get infected using the vaccine. And we use a control group that we don't give them the vaccine. They are well, they don't have the infection as well. And we give them some sort of what we call placebo. It's not a vaccine, does not have the effective ingredient. And we follow them over time, and we compare the infection rate among the people who took the vaccine and people who took the placebo or the substance that does not have the vaccine. The clinical trial that reached phase 3, it was, I don't remember the name of the vaccine. It has some letters and numbers. It was conducted on thousands of individuals, and 100 cases developed coronavirus in both groups, the one who took the placebo and the one who took the vaccine. The 100 people who got the virus, 95% were not vaccinated and 5 were vaccinated. That's why we say that the vaccine was 95% effective, because among those who were effective, 95 were not vaccinated and 5 only were vaccinated. So among 5 only were vaccinated and 95 were not. At this stage, the safety and toxicity were examined in phase 2 and phase 1. So we test in phase 3 the effectiveness of the vaccine. So this is beyond safety. Regarding the approval from the WHO, till this point, the WHO did not approve this, to my knowledge, did not approve this vaccine. And the clinical trial is still going on. They need to to get a larger number of cases and compare how much among those cases are vaccinated compared to non-vaccinated to have a conclusive result. You raised important questions that we still need to answer. We don't know the answer of these questions yet. We don't know if the person who took the vaccine, how long again the immunity lasts, for how much protection the vaccine offers. And the quality again of the immunity. Does it a strong immunity, 90% immunity, 95% immunity, 100% protection? We don't have answer to this one. again, the vaccine, does it offer protection from the disease? So if I got the virus, the vaccine protects me from progressing to a severe disease, or does it kill the virus so that it diminishes or eliminates infectivity? So the person does not have the virus and does not spread the virus. Because if the vaccine eliminates only pathogenicity, meaning that it prevents the person from progressing into severe disease, and does not prevent infectivity, meaning that the virus can still be in the throat of this person without having symptoms, it means that the person can spread the virus, though it doesn't have the disease, but can still transmit the virus to others. Although it's protected, the person is protected from the disease, but still has the virus and can transmit it to other persons. So we don't have even answer to this question, and the trial does not provide, because the report is not yet published. We don't know if it protects from infectivity or pathogenicity and infectivity.
Yes.
And again, the immunity and the quality. So many things still needs to be answered. Question marks on so many questions that we need to have answers for.
Well, does the vaccine work on your immune system, the immunology, and does it contain any sort of antivirus? Because a lot of people, they can develop antibacterial or antivirus if they're infected. Does the vaccine contain any of these antivirus that could be given to the infected people?
The vaccine, it enhances your immune system to produce antibodies that blocks the virus or protects you from the effect of the virus.
But so it doesn't give you the antibodies right away?
No, it's not. There are two types of prophylaxis. The vaccine usually promotes the immune system to produce antibodies. There are some sort of other protection called seroprophylaxis, when you are given ready formed antibodies, and this is short-lived immunity. It doesn't last for a long time. Like, for example, if you are bitten by a dog, we give you an anti-rabies serum. So it has a neutralizing antibodies till your body produces the antibodies.
Yes.
But this is a different story.
Yes.
But for the vaccine, for corona, it enhances or it triggers the immune system to produce antibodies against the corona. But as I mentioned, are these antibodies blocks the it's very scientific way of explaining. It doesn't need for the public to know. It's for the scientific community to answer this question. But I mean, there are so many questions that are pending that needs to be answered by the scientific community in order to have to say that this vaccine is effective, this vaccine can offer long-lasting immunity, it can protect you by this percentage, so it's still so many things to be
Dr. Nasr, you've talked about the changing characteristics of the pandemic in general, but do we know any, or is there any sort of change in the characteristics of the virus itself, or is this still a big question mark? Do we know that the behavior or the characteristics of the virus, did they change since late December of last year?
I don't have an answer. My readings, there is no scientific paper I've went through that says that the virus has been weakened or the virulence has been changed. There are different phenotypes of the virus. And again, the virologists and people who are in this field, they said that it does not affect even, it's not a dramatic changes between, there are like the different strains or the different types of the virus, they are not huge changes between the different types. So it even does not affect the vaccine development or the behavior. It's in my reading, it's the same, although they have different types. And there is no any publication said that the virus becomes weaker or less virulent.
Yes. Well, ladies and gentlemen, as you've heard from Dr. Nasr, still many big question marks surrounding the characteristics of the virus or the pandemic as a whole. But one thing is for sure, that people still need to take this seriously, still need to abide by the precautionary measures, the coughing etiquettes, the wearing the masks, the hygiene, everything according to all the
Social
doctors
distancing.
and the social distancing, of
On the
course.
top.
Yes, definitely. Ladies and gentlemen, unfortunately, that's all the time we have for this edition of the Daily Debate. But before we go, I'd like to thank my very distinguished guest, Dr. Ghada Nasr, the Professor of Public Health at the Faculty of Medicine, Cairo University, and also the WHO consultant. Dr. Nasr, it was a pleasure having you with us.
Thanks so much.
Thank you very much. Ladies and gentlemen, please stay tuned for more coming up on Nile International. I'm Henny Saif. Thank you for joining us.